afternoon, everyone. I will introduce you today my PhD topic, which is about developmental defects of enamel, etiological aspects, and clinical management. My name is Mlinkó. I'm a PhD student and a specialist at the Department of Pediatric Dentistry and Orthodontics. My ambition as a PhD student is to improve the life quality of children with developmental defects of enamel with better clinical assessment. And my mission is to detect warning signs of general pathologies, discover causes of developmental defects of enamel, and finding new intervention protocols that are improving pediatric dentistry. To achieve this mission, these are the two projects about understanding the development of enamel defects through certain risk factors and metabolic processes, which are my specific goals, and I will explain you them ahead. My first topic is investigating different types of antibiotics at early childhood as risk factors in molar incisor hypomineralization, so in MIH. The background is the MIH is an enamel defect which affects the first permanent molar and the incisor with wide clinical appearance. This is the most frequent enamel disturbance with the global prevalence of 13.5%. The etiology is still unclear, but we already know the amelogenesis of the affected teeth are at the same chronological time. And many putative factors are associated with this MIH, which are mentioned in the literature. And we already know that the tetracycline has a harmful effect in tooth development, but there are less knowledge about the effect of other antibiotics. So our aim is to evaluate the association between early childhood antibiotic intake and MIH. The clinical question is that do early childhood antibiotic intake increase the risk of molar incisor hypomineralization? The question framework is a PO. The population are children. The exposure would be generally antibiotics and the different types of them. And the outcome is this dental condition, the molar incisor hypomineralization. The hypothesis is that early childhood antibiotics increases the risk of molar incisor hypomineralization. The clinical implication is regarding to the extreme hypersensitivity of these teeth and really complicated clinical management to recognize opportunities for prevention. Here you can see our systematic search with 3 databases and the search key where we use 2 domains. First is with this dental developmental defect, and the second is about the risk factor. And here is our flowchart selection. My pair was Dalma Tabi, and we found 1,800 results firstly, and then we finished with 35 eligible full-text articles. The second project is investigating the association between phosphocalcic metabolism disorders and developmental defects of enamel. The background is that these developmental defects can be qualitative or quantitative disturbances, which can range from mild problems till even the total absence of the enamel. The prevalence is both in the primary and in the permanent dentition 30% around, and the etiology is multifactorial. As for the amelogenesis, in the mineralization phase, the calcium and phosphates are needed for the ameloblasts, so for the enamel-forming cells, for hydroxyapatite crystal growth, which takes 90% of the enamel tissue. And disrupting the calcium homeostasis can directly make disruption in the enamel formation as well. The second part of this background is the phosphocalcic metabolism problems. The homeostasis is regulated by parathyroid hormone, vitamin D, and fibroblast growth factors, and these are regulated mainly at 3 organs: the intestine, kidney, and bone. If there is any imbalance, it can cause hypo or hypercalcemia and hypo or hyperphosphatemia, including the parathyroid, vitamin D deficiency, and chronic kidney diseases. And also there are some chronic disorders like celiac disease, diabetes, thyroid dysfunction, and the cystic fibrosis, which can cause reduced calcium level, and they can have an impact as well on the enamel formation. The prevalence data are listed here. So our aim is regarding to the phosphocalcic metabolism problems, and it might have an effect to the teeth development, to evaluate the impact of phosphocalcic metabolism disorders on the appearance of developmental defects of enamel. The question is, do the phosphocalcic metabolism disorders increase the odds of developmental defects of the enamel? The question framework would be the same PO as in the previous project. The target population are children. The exposure would be the disorders affecting the phosphocalcic metabolism, and the outcome are broader in this project. It's all the developmental defects of the enamel. The hypothesis is that phosphocalcic metabolism disorders increase the risk of developmental defects of the enamel. And here is our systematic search with, again, the 3 database results. And the search key where we used 2 domains. The first is the broader enamel defect types, and the second is the different chronic diseases. And here the third is that we would like to check just the human studies. Here is, so this project is just at the start. Here is, so we are at the beginning of the selection. And here is the overview where these 2 projects, both of them are systematic review and meta-analysis. And my plan is to finish them. The first is in spring, and the second is the next summer. And I would like to say thank you with this quote, that the aim of science is not to open the door to infinite wisdom, but to set some limit on infinite error. Thank you for your attention.
Thank you, Eva, your presentation. I have 2 questions, both of them regarding the first topic. The first is about the outcome. You said that the first outcome would be the MIH, and how can you measure it? Does it have different stages, or how could you measure it correctly? And the second one is regarding the exposures. That are you planning to make a subgroup analysis based on the different antibiotics?
Thank you for the question. The first part of the question is that, so the answer is that there is a European Association of Pediatric Dentistry guideline where we can exactly diagnose this disease. There are wide ranges of them, but the aim or the target of this study is now that if there is any influence on the appearance of the MIH, so with this guideline, which is listed in the literature and in most of the articles, they diagnose this disease with this protocol. We can exactly choose the population. As for the second, yes, we, regarding to the knowledge and the literature what we have, we will use a group with generally the antibiotics, and we can use subgroups with the different types of them.
Congratulations, Eva, for your presentation. Can you just tell us about some possible confounding factors that this population might have that could affect your results to see the effect, for example, of your exposure for both of the projects? Mm-hmm.
So in the first, we would like to target the population which are healthy children, where we don't want anything which can influence the effect of the antibiotics. And in the second part, we would like to see children who had already this developmental defect, but with early childhood chronic diseases.
Thank you very much, Eva, for your presentation. What are you planning on doing in regards of the dosage and the duration of the antibiotics given? Probably the dosage and the time given would also then influence the molar hypomineralization.
Yeah, the development of these teeth, the first permanent molars and the incisors, are starting from the 16th week prenatally and finish at around the age of 5. So we have just results in the literature where they used at early childhood antibiotics. So we will divide maybe the data where we have enough for how many times they have antibiotic intake, but there are some where we have just that they get antibiotic or not in under 5 years of age.